Welcome to this episode of TAC Tick Talk. This episode, we are gathered here, Jaclyn, the publisher of the American Chiropractor magazine, and I am Dr. Joe Busch, the editor of the American Chiropractor magazine. We are joined by Dr. Howard Loomis. Dr. Loomis has an extensive background in enzymes and enzyme supplements and is the founder and president of the Food Enzyme Institute. With this extensive physiology, biochemistry, and enzymology knowledge, you've created this enormous company in the Midwest and just created a huge following and really been a pioneer for enzyme nutrition over the past, I guess, now, 40 years probably. So welcome, Dr. Loomis. Can you go ahead and just tell us a little bit about how you started to get into enzymes and notice that they were playing an important role in
and before health? Doc even gets to say anything, Dr. Joe, I just wanted to, just like when the rock star comes out on stage, they've got to have somebody warm them up. So I'm just saying, Dr. Loomis has been writing with the American Chiropractor ever since I've been here, which is at least over 27 years. And his articles, when they run in the magazine, have always gotten the most requests and feedback from doctors. So I just wanted to make sure that everybody knows this is not some novice person we're talking with. This is somebody who, when the things are going wrong, like during COVID, the doctor I'm so thrilled I get to call is Dr. Howard Loomis. Because if there's anybody who knows, it's somebody who has been a practicing doctor and also then adding on a supplement line that actually coincides specifically for chiropractors. So, Dr. Loomis, that being said, take it away. Tell us all about yourself.
Well, thank you very much for the very kind introduction. I'm happy to be with you, the two of you. It's been some time since we've had time to spend together. My introduction into enzymes came in 1980. I had graduated from Logan Chiropractic College in 68 and went into practice with one primary idea, and that was disc degeneration was caused by the inability to digest and assimilate and utilize protein. And the simple fact is that the nucleus is composed primarily of protein and water. And so it made sense to me, although at that time, that information was not known. You have to remember, I go back to 1968. So anyway, they've even discovered that the disc has a nerve supply, which we didn't know when I was in school. But I had gotten through school working in hospitals at night and in laboratories. So it was natural for me to come out of school and do blood work and urinalysis, as well as my chiropractic examinations, trying to determine how to best improve protein metabolism in my patients who had disc degeneration. And I spent 12 years in that and got absolutely nowhere. And I did everything that I could imaginable in supplements and etc. And just nothing was ever consistent, and it didn't make any sense physiologically. And in 1980, the National Enzyme Company walked in my front door, and they were aware of the work that I did with blood and urinalysis and examinations, and said that they had food enzymes, and they felt that there was a need for them professionally. However, in 1980, there was no food enzyme market as there is today. Today, it's a multi-billion-dollar industry, and they're available all over. So they asked me if I would get interested in working with them. I was, and I got very excited. And for 5 years, I did clinical outcome work in my practice with my patients. And I came up with the suggested formulas that they produced. We gave them away to the patients. We measured them. And then in 1985, they informed me that I now had to begin to lecture and to write. And so at that point, we began to do that. And the rest is just, it's gotten bigger and bigger and bigger. In 1993, they came to me and said they no longer wanted to sell the supplements that we had formulated, because too many people were coming to them asking for enzymes to be put into their supplements. And so they said, we'll buy out your contract if you want. You can go form your own company or whatever you want to. And so at that point, I was, 58, I think. My children were raised and out of the house. And so I decided, did I really want to do that or retire? And I decided I wanted to do it. And so I came to Madison, Wisconsin, where I had a number of patients, oddly enough. I had practiced in Southwest Missouri and opened up my company. And then I think it was in 2002, the state of Wisconsin recognized the educational work that we were doing, and they have certified us as a legitimate educational institution. And so we jumped through the same financial and curriculum categories that your technical schools, business schools, and that. And we've maintained a perfect record with them ever since. So we're very happy about that. And then recently, we have just completed a 48-hour certification course for chiropractors in nutrition so that they can use nutritional supplements here in Wisconsin. It will be online, and I know that they are attempting to make that available to chiropractic students at the various colleges. So outside of that,
outstanding. Well, how will that be available, Dr. Loomis?
It'll be available on the Food Enzyme Institute website, and you would simply log in and I'll go from there. You take it, take it at your own pace. And
So with all this background, your original goal was to help with the degenerated discs. What is your conclusion, Ben? Has this contributed to a change in how the deterioration of the disc occurs, or?
Well, it doesn't change in how it occurs, of course, because that's normally through wear and tear and injury. But as you know, Dr. Joe, if you have still got 25% of that nucleus left, we can replump it. If we can deliver the nutrition. But it involves, obviously, with digestion of adequate protein. And then you have to obviously absorb it, transport it, utilize it, and eliminate it, all of that. And the whole protein scheme took me way beyond intervertebral disc. But to answer your question, yes, it's very specific, very, very specific. I think one of the most exciting things that I got into with it after, I don't know, probably I was working with it maybe 7 years, and all of a sudden it became obvious that women had a major problem with protein, and it was responsible for premenstrual stress syndrome symptoms. And I don't mean to be funny here now, but at that time, a woman would come in with that, and she had normally done everything that she could. She was usually on some muscle relaxer or some antidepressant or something like that. And in order to try to diagnose PMS and the cause of it, you had to listen to a long list of unrelated symptoms. And what I found out was that in 1970, Columbia University Medical School released a study on 130 women that they studied for 3 years. 2,000 women that they studied for 3 years. And they found 135 symptoms that were related to PMS, and they concluded it was not a treatable condition. The University of Iowa updated that in 2012 and confirmed it, except that they now were able to identify 145 different symptoms. And again, it's not a treatable condition pharmaceutically. But if you can find the reason for her protein deficiency, And it's lengthy. I won't go into it right now, but if you can find it, and you can do that as a chiropractor examining her with the methods that we teach, you can solve the mess.
Mm-hmm. Well, now, and Doc, isn't that the subject matter that you guys just covered in your annual symposium recently?
Yes, it was. It was. In fact, it was the second time that I had originally done that in our annual symposium in 2011. And then we went back and reprised it and brought it back up to date this year.
Mm-hmm. And that's also going to be available, isn't it, to doctors so they can access it online through the Food Enzyme Institute website?
Yes, it was recorded professionally, and they're working on it to get it up on our website pretty quick. In fact, we have a lot of seminars available over the years that we've recorded.
Mm-hmm.
Sure.
Mm-hmm.
So look for that on the Food Enzyme Institute website. Now, Dr. Loomis, we've been fortunate to be able to meet with you over the past several decades, and we've really, it's a privilege and an honor because you were the first person talking about enzymes, and fortunately, you're a chiropractor, and it was, within our pages even over the years. So how have you seen this whole area of health evolve? I mean, went from the time when you were first beginning in the 80s with the enzyme and company that showed up at your door. Now everyone has a protocol with some kind of enzyme influence on the GI system. How have you seen this market shift over the years? And do you think it's going in the right direction in the pop culture or, with the practitioners that you're training? How do you see that different?
Well, it's a fascinating question, and I appreciate it. Nutrition is primarily practiced in this country on a pharmaceutical model. That is to say, you find a symptom and you come up with a vitamin or mineral or enzyme or something that should relieve it. But it is subjective information. What is needed to apply enzymes specifically is an examination procedure so that you find out precisely which enzyme or enzyme combination this patient is deficient in. And they have caused that essentially by dietary abuse. I mean, let's face it, that's the bottom line. And so you find out what it is they're craving, for example, and find out what they don't eat because it upsets them, and you've just cracked the door and you can walk in and you can usually fix it. If you can solve their cravings by delivering food properly digested and absorbed so they can utilize it, you can solve a craving. And if they are having trouble with something that they cannot digest properly, you can improve their digestion. Not necessarily that they can go out and eat all of whatever it was before, but they won't have any more problems with it. For example, gluten. It's very easy to solve. Mm-hmm. One of the biggest problems in nutrition today is the fact that patients who do not adequately digest fat crave sugar. And so when you're dealing with this patient, you see a sugar baby, somebody that craves sugar because they need the energy. Normally what the body does, of course, is you consume food, and insulin then will, once it's digested, will deliver the glucose into the cells to produce energy, but it also delivers it into the fat cells for storage, just in case we need it in the future. And so that's how it works. Well, if one of the things that I have found that clinicians may not really be aware of adequately is in looking at the pharmaceutical model, medicine doesn't have a drug to improve digestion. So if you're having digestive complaints, they turn off stomach acid, heartburn, indigestion, gas, they turn it off. But that is the very first step in protein digestion. And the other thing that they forget is that it is the acid which is dripping out of the stomach through the pyloric valve onto the wall of the duodenum, that stimulates the flow of bile. So if you're turning off stomach acid, you're turning off the bile, you're not digesting fat, and you begin to increase your sugar content. It's a lot of this physiology comes right down to it. But doctor, what we don't realize is that it's not taught to us that way in the physiology books. It's taught to us from a pharmaceutical standpoint. Now, I'm not anti-pharmaceuticals. They're used to treat disease, when we have total respect for that. But they do not.
Mm-hmm.
There's not a pharmaceutical drug made that can restore normal function. And that's the bottom line. They turn off normal function, and that's why they all have side effects. With enzymes and supplements, we can restore normal function, assuming that there is not yet a pathological process in place. And when there is, of course, they have to be treated medically.
Mm-hmm.
Well, when you explain it that way, I mean, not only with the stomach acid getting turned off, I mean, they'll pull out your gallbladder as well. So as you see these neurodegenerative conditions that are coming on, a lot of the science they're saying is oriented towards glucose or blood sugar intolerance, right?
Yes.
But then you got the fat digestion too. So, all of the new science would tend to point definitely towards what you're saying, but they don't interpret the whole GI system in the way that, you have. I don't think anyone else does it the way that you do. So
How does that feel? Is that a lonely world, Doc, to live in?
Well, it took me 5 years to figure it out. So I didn't think that I was any joy, any prize here. I mean, every time that I began to use an enzyme and it would change function in the human body, I'd go back to my physiology book and it wasn't there. And I thought, holy cow, where are we? But we finally got there, because the human body is very, very precise. It knows what it wants if you just can read it, and it'll tell you. But you have to have an examination procedure, and you cannot throw these things at it just because they have a symptom. That's the pharmaceutical model. A nutritional model. And remember, isolated vitamins and minerals they're not food. They're not food. Food is carbohydrate, protein, lipid, vitamins, minerals, and enzymes. That's a real food according to the FDA. Well, an isolated vitamin or mineral is not food. And so it may be that 20% of the population needs this particular vitamin, isolated vitamin, when they have these symptoms. But how do you know the patient in front of you falls into that 20%? See, pharmacology practices on a curve, just like you get graded in college. Some A's, some F's, and some D's. Everybody is a B or a C. But how do you know that the patient sitting in your examination room where they fit into that scheme? You have to treat them as an individual. And once you change that methodology and that mindset, then the world opens up to you.
So if, there are listeners out there probably who are unfamiliar with your technique and your approach. If they hear this and they start talking about enzymes, maybe they're thinking lipase, some of these different digestive enzymes that they can buy at their local pharmacy, and if what they view as being influencing protein digestion or fat digestion. So how do your enzymes differ from that?
We make specific enzyme formulations for specific physiological dysfunctions. We don't use a shotgun approach, which I think is what you're talking about. You can buy a lipase or a protease or an amylase, and that's fine. You have nothing wrong with that, as long as you know what it is precisely you're wanting to do. But if you can examine and find out precisely where this patient's problem is, physiologically, and what you're trying to feed. For example, you can just take any symptom at all. It is just an expression of the body telling you it is energy deficient. energy deficient, you have to find out what specific organ or tissue is not able to take in enough nutrition to produce the energy that it is intended to be putting out. Let me put it to you differently. Enzymes are the only supplement that you can use that has the capacity to perform work. Carbohydrates, protein, lipid, vitamins, and minerals do not perform work. You're both sitting in an office. That office would still be a pile of bricks and concrete and windows if it wasn't for the workers. If you can apply the worker specifically, you've got it. You know exactly what so you need an examination procedure in order to determine that.
Well, and Doc, I wanted to throw in and ask, because I know people have heard a lot about multi-digestive enzymes and things. So how does your system vary with a doctor saying, okay, well, I'm just going to tell everybody to take a digestive enzyme?
Well, that's good. That's fine. That would improve something. But is it going to improve specifically what that patient needs? But yeah, that's a great approach. It's like taking a multivitamin every day.
It's better than none.
Better than none.
But
there you go. And you know, you might get lucky. Let's face it. That's what it comes down to. But so, you know, if you want to be successful in practice, you have got to be better than lucky. That's my opinion.
Right.
You don't have to agree with that.
Well, and your system, as I understand, is even the supplements themselves have been creative from the chiropractic standpoint even. You know, I know that the names have changed of your product line over the years, or of the what is now the Loomis enzyme product line. Those that you're the formulator, correct? And
yes.
Now but it was originally all kind of based on even the name of the vertebra, correct?
Originally it was, yes. That was not the proper way to sell, however. So, but it made sense to me. But yes,
that's the most important thing, right? We got to be able to sell it. Right?
You got to be able to sell it, right? That's not my job. That was never my job.
Yeah, you get the science right, and still it has to, you know. So now, can you talk a bit about the examination? You mentioned that a little in this, and that's how it varies, and being specific in what you're.
Well, it's really not based on a chiropractic model. Jaclyn was right. We used to identify it by subluxation because I thought that's what chiropractors needed. But it's based on simple palpation. And in order to get the answer, it's an easy answer. You go back into embryology. And in the first 3 weeks of embryonic life, if you had an embryo and you could put it under a light microscope and look at it, you would see 3 layers: an ectoderm, a mesoderm, and an endoderm, outside, middle, and inside. And just very simply, the inside layers are where most of your organs are going to develop. The outside layer, of course, is your skin and hair and nails and even the nervous system. The middle layer is where the musculoskeletal system develops. Now, after 21 days of embryonic life, you go into the 4th week. If you take an embryo and look at it again, you do not see the middle layer because it has diffused into the outside and inside. So what I've just said to you is that every visceral organ has a connection to the musculoskeletal system. So when one of those organs gets in trouble, now remember, we're in the 3rd week of embryonic life, it sends a message through the peripheral system up the cord into the brain. And the brain sends a message back. But it can't send it specifically to the organ that cannot produce energy to perform its function. It has to send it to all 3 layers. And those connections were put there in the 3rd week of embryonic life, and they're there for life. unless a nervous cut, of course. So what I've just said is if you have an organ, let's say a gallbladder or biliary function, and the body is saying, look, we're not, this bile is not pumping into the duodenum properly, and the message is going back, the bile is getting thick. It sends a message up to the brain, and the brain says, do this about that. But the muscles that share the innervation, which for the gallbladder, as you know, come from T4 to T8, also contract. So you will have involuntary muscle contraction under the right anterior costal arch. You'll also have subluxations because of the involuntary muscle contraction between T4 and T8. It's just that simple. And that isn't chiropractic, that's physiology and neurology and anatomy. A little histology and embryology thrown in. That's it. It's that simple, and you can't change it.
It makes sense, and it is kind of simple.
Are you talking about the coastal? Yeah, the coastal arch. Where is that?
That's your rib cage. It's right in the front. It's right under your rib cage.
Okay.
You got one on the left and one on the right.
No.
The one on the left is a pancreas. The one on the right is gallbladder, liver. One in the middle is the stomach, Jaclyn.
Okay. Got it.
And all you do is, every chiropractor is trained to palpate. This stuff is easy to feel. Now, I don't know if they teach palpation as extensively as they did when I was in school, but, surely they're...
Well, they can
I'm
learn it.
I'm inclined to believe not as intensely as what you did, just based on some of the reports I've heard from students. And I know what you guys went through was perhaps even, more intense than most. So,
well, and speaking of that, I wanted to jump on because there was a topic. I remember Dr. Loomis, there's always, even with nutrition, blood testing tends to be the medically preferred and the gold standard. But at the end of the day, that's only like a snapshot in time. And that's where then you get into these energetic kind of different types of methods. And you've written one of, the most encompassing columns with us on that. And so I wanted to just check with you if you wanted to address for us the difference, blood testing versus palpation and other types of things, and obviously your system. So that how do you feel that blood testing fits into diagnosing nutritional issues? And is it necessary, or when do you know to use it, or how often?
Well, obviously, you're going to use it as a screening thing at any point that there's symptoms, but changes in blood work are actually a late sign. What I used to tell them at the seminars is that palpation is right now. It's right now at this moment that there's muscle contraction there. If we want to understand, however, what's going on into a patient's life, one of the primary ways, and in fact, the first way that I found that was reliable, was to collect a 24-hour urine sample. And so you know what the standards are, what is normal and what is not normal. And from that, you can deduct what the patient is throwing away because they have too much of it, or holding because they don't have enough of it. And you can read that like a book. And we've taught that. That's the first thing I started with that was really reliable. And I did that I was doing that in the 70s before enzymes came in. That's one of the ways that I got a jump start on it. But the blood work is a late sign. So by the time it has changed, it doesn't mean you're diseased, but it means this has been going on for a while and you better do something about it. Does that help? There's a church of the here and now, and then there's a 24-hour window, and then there's last week. That's how I look at it.
So you're still doing the 24-hour urine tests, I would think.
Yeah, that's a mainstay.
Well, how many patients? So then that was what I was going to say, because how many patients will do a 24-hour urinalysis?
What I have found out what I have found out is that patients are not reluctant to do it. Doctors are reluctant to ask for it.
Mm-hmm.
I mean, I'm sure there are some students out there listening right now that their mind is blown that you would ever think about doing a 24-hour urinalysis. Okay.
I love it.
And
I've
until
never
you see
actually,
someone with a styrofoam container, it doesn't hit home.
Well, hey, that's how.
But no, I mean, it's,
I'll tell you what. I know that. I know that Jaclyn remembers Dr. Firkin. Dr. Joe, I don't know if you remember Dennis or not, but he worked with me. He came to one of my first seminars in 1985. And when he's talked about when he would go into his office, there would be these jugs lined up on the sidewalk outside his door, just waiting to be run. Yes. Patients are happy to perform whatever test you need that's going to help them to get well. They'll do it. What I have found is that the reluctance is on the part of the practitioner.
right.
well,
And so
everyone can deal with that, right? Having a line of urine containers outside
Dr.
their
Joe,
door.
I'm sure there's like some room you could store them in now, but that was just
No,
that
but
time.
that was science, right? If that's
These things have changed then.
But that's
Yeah.
one heck of a marketing tool, quite frankly. That's a good marketing tool.
Yes, absolutely. But we used to teach it.
But that's okay.
We used to teach them how to do it, actually mix the chemicals long before we ran into, various, you don't want to do this in the testing in your office anymore, obviously, but we have laboratories that do it. The doctor doesn't have to do anything. You give them the container and they collect it and they take a sample and mail it to the lab and the lab sends it back to you.
Well, honestly, I think that so many of the other options are so short-sighted, and even blood testing is super expensive.
Yeah.
And time can, like if you have to keep going back over and over again. So it does make sense.
For a moment in time, just like that minute. And, it's.
But I'm saying it's expensive when you have to go back even month after month. You know what I mean? It adds up really fast. So, I mean, I don't know how expensive, but I think that if it's going to give a little bit more certainty to the patients, like Doc says, I know that the only thing is like you said, teaching them how to do it. Is it like in a gallon size? Is that it? I've seen where they store it and take it in like a gallon size.
A liter,
milk
not
carton
a gallon,
or milk
not a gallon,
jug?
a liter. A liter will get it.
So
They have containers.
now, this is what's fascinating.
I will send it to you.
This is what's so fascinating to me is that's considered an old technique, right? But I mean, those techniques worked. That's why they were around. And now it's like history's forgotten, unless we're talking to you, Dr. Loomis, or someone who's gone to your courses. Like everyone's trying to forget these old approaches that actually were highly effective. Now that we have everything so influenced by the major media, they don't even want to allow magazines to be mailed out anymore, so which we're still doing, of course, carrying that message. And if you want to do it online, you're at risk sometimes because if your message is not what they approve, they'll make it so that you can't even get to the website. So I've always admired, talking to you about these topics. You're carrying that torch forward. And I just wanted to point that out. I mean, what do you think about the direction of modern healthcare? You're carrying this message with the enzymes
You don't
and these
really
evaluation
want to
methods, which
I think it's a pharmaceutical world.
I know
It's a pharmaceutical world. That's really what you're saying. And what I'm saying is, if you're in an alternative practice, the pharmaceutical approach is not going to work for you. One of the things that fascinated me, I told you I worked all night in hospitals. That's how I got through Logan. And I was always fascinated with the blood work issue. And I got to know the senior lab tech and had extensive conversations with him so that I would be able to interpret blood work the way they did in the hospital. And that was a major mistake because it's so large and so vast. The connections are mind-boggling. But it is what's going on now. Fortunately, now they have computers that can put all that together. But what I found out was if you look at how the body maintains homeostasis, normal pH, temperature, volume, and concentration of dissolved substances that you do blood work for, that's homeostasis. If you look at how it does that, you can take your blood tests and put them in an order, starting with A and going down to Z, and just fill in the high or low and read it just like a book. And guess what? It starts with what? Protein. Protein is it's number one. Now, the body requires carbohydrate first for energy, but it's protein that maintains everything else, and including the essential compounds that are made out of it, which are insulin, thyroxine, epinephrine, hemoglobin, dopamine, serotonin. If you're protein deficient, for heaven's sake, you're going to be in deep trouble. And it's just a matter of which one of those neurotransmitters or are going to, or essential compounds or hormones, that's going to become deficient. But stop and think about it. This is part of what I'm writing for next year. Let's take a PMS patient. All right. We know that she's protein deficient. And if that's all you correct with a multiple digestive formula, like you were talking about, she might get better. She might. But when she doesn't, then you have to go to the things that are made out of protein: insulin, thyroxine, epinephrine or adrenaline, if you will, hemoglobin, dopamine, or serotonin, and you've got your answer. And once that's solved, guess what? No more PMS. And that's my story, and I'm sticking to it.
Well, adjacent to that, Dr. Loomis, because now there's, and throughout the last several decades too, you have the Atkins diet with, which is a protein dominant diet. You have now, what is it? The
ketogenic diet. Yes, all the various diets. And to all of them.
And then you got fasting.
Yes. And to all of them, I say.
So how do you see these?
Can you digest it? And if you fast, what is already starved that you're going to really cause some problems with if you go to fast? See, this is what I'm saying. Your question is perfect. It's a shotgun world. And what I'm saying is not. You have to take each individual patient and apply the normal physiological functions in that body and find out which one is not working, and then feed it. That's it. Now, it's very simple to say.
Very good. Well, on that,
but it's a lot to do. But boy, is it interesting and fascinating.
Well, Doc, I gotta say, personally, after all these years and studying everybody who's studying everything and trying out all these different diets, I remember at some point when I was eating all raw food, I think I made it to 13 days of raw vegetarian on an 80-10-10 diet. And after 13 days, I was like, you know what? I'm not an Olympic athlete. And gosh darn it, I'm going to enjoy every meal for the rest of my life.
There you go.
So I like that your system teaches people how to heal what's actually broken inside that is making it so they can't eat all these things, because everybody's going through all these, real crisis management things to help heal, but they're not, like you said, they could be exacerbating the problem. And as a woman, fasting isn't always a good thing.
Yeah.
So that's the thing that that I'm always appreciative of, that you're actually really dedicated to, even, when you talk about women's health. But even, obviously men's health as well. Digestion is huge because we all have been trying to look at what we're eating, but the food supply is now in such a state that nobody's able to digest and absorb the minerals. And so that's devastating.
That's right.
So that you've got a solution for it is awesome. So
anyone out there interested in learning more about Dr. Loomis's program, there's 46-hour program on his Food Enzyme Institute that you can look for, right?
Yeah.
That will help you understand some of these topics, but you have a much broader program too.
Yes, we do.
That you offer as well. And then you can also go to the digital.theamericanchiropractor.com website for Dr. Dr. Loomis has been a contributing author for years. 2012, we had an interview in the December issue. I think we're going to have some big article in January of 2025, which is just a couple months away now. So look for that. The godfather of enzyme nutrition. Thank you very much for your time here today, Dr. Loomis. It's never enough time. I would enjoy talking to you for the next hour, but I understand you have things to do as well.
Well, I have loved talking to both of you. Take care.
We always love talking with you, Doc. And so we'll look forward to another one of these podcast interviews.
All right. We can do it.
Absolutely.